And moreover, this drug is mostly been, if you look into data, is being consumed by more MSM, where there is unsafe sex, and many times people doesn't use contraceptives like condom. Now this drug PrEP, what we call is pre-exposure prophylaxis, it's a combination of two molecules. It's tenofovir and emtricitabine. Now this drug is used as a prevention strategy by the infectious disease doctors, by other specialties doctors as well, so as to prevent the risk-prone population to get an HIV. Now, for example, the sex workers who are more prone to get HIV from their partners, or it is about an husband-wife where husband is HIV positive and wife is HIV negative. So that woman can take this PrEP so as to prevent this infection to be spreaded to her body. On the other side, there are other transmission factors like injectables. People, like, because of, we heard about drugs, so people use the same syringe and all. So there is a risk of getting an HIV into the body from an infected person through these needles, infected needles. So there also this drug can be given to these prone population, and you can save so many lives. And moreover, this drug is mostly been, if you look into data, is being consumed by more MSM, where there is unsafe sex, and many times people doesn't use contraceptives like condom. So there, if one can take this drug, so they are prevented from catching this infection of HIV from an infected individual. So as per the studies, if one can take PrEP regularly and follow the proper regime of as prescribed by the doctor, this gives a prevention of more than 99% from the HIV infection. PrEP is a purely prescription drug, and one has to take a prescription from a doctor before taking this drug. And the regime is 1 pill a day, but there are various regimes which are event-based also, where the person see that they see a particular event coming up, so they can also go for the event-based PrEP regime. So this is something which a doctor is the best to decide for you. So a patient who see that he has to take, or he or she has to take the PrEP, they have to consult the doctor first. Cost varies from the countries to countries. So if I talk about the Western world, this drug is very expensive. But looking into the economic status of the Philippines and emerging economies, our company Hetero is making this very affordable. So in Philippines, we are selling this as 50 pesos a tablet, and it is a pack of 30 tablets, and it is available across the drug chains. And at the same time, government of Philippines have also recognized the requirement of this kind of prevention for HIV, and they've also included this drug into their government procurement program. So we're also supplying this to Department of Health, where Department of Health is providing this drug to their various hubs, and many patients can avail it free of cost from this government hubs of HIV treatment centers. If I tell about today's status about the awareness of HIV of Philippines is still, I'll say, very low. Still, so many percentage of population doesn't understand what is this infection is, how this is spread. Though government, Department of Health, hospitals, they are making a lot of awareness campaigns, and even though print media is making a lot of awareness about this disease nowadays, so that more and more people are aware about it, and they know about the status that whether they are HIV infected, if they are HIV infected, where they have to go, what kind of treatment is required, and especially to the risky population, it is advised that if they face any kind of this kind of exposure, they should know where are the treatment hubs so that they can get the proper diagnosis done. So I see there is still a big gap in the terms of diagnosis. Many of the patients here doesn't know about their HIV status. So this is something where UNAIDS or about the various big agencies of United Nations. They are working so as to make population more and more aware about HIV, and so that the people can go for the diagnosis, and if they are diagnosed with an HIV, they should not take as a stigma, or they should not see this as a warrant of death,